Can you tell us about your vision as president for AAPI?
Well, AAPI is one of the largest ethnic organization in the United States. It's a wonderful platform to work on healthcare policies and also to address our members' issues that face all the members on a daily basis, whether we are in private practice or whether we are employed by hospitals. We face problems every day of our lives. It's not evident to the media or other people. They think physicians are just there to come and see patients and they're having a good time. It's not in all black and white. There's a lot of things going behind, like pre-certifications, medications. There's so much of obstruction from insurance companies. We fight every day, hospital systems. And these are the kind of things I really want to address for our members. So I am very member focused, and that's why I wanted to do this, because I want to do something for the members.
You talk about your members, but then when we think about society in general, a lot of us became aware of the hardships the doctors face, nurses face during the COVID pandemic. A lot of them came to light. Post-COVID, hospitals are still struggling. And, it kind of changed the narrative of the way we, as non-doctors, really view the medical community. In general, you have a very interesting story during COVID yourself. It's remarkable. Can you talk about, and as a doctor?
Absolutely. I developed COVID on April 6, 2020, and I passed out and I was admitted to Ohio State University and was on ECMO. So I was on a ventilator for 65 days. During the process, they perforated my right ventricle and I was coded for 42 minutes. So they were literally going to call off the code and declare me dead. Post that, I unfortunately developed compartment syndrome, but at that time there was a law protecting physicians and healthcare personnel and hospitals from getting into any malpractices. So for some reason, people were also kind of scared of COVID. So I literally got neglected in the hospital. So for 18 days, I was in the hospital with my compartment syndrome. There was so much of negligence and my whole arm became gangrenous and I lost the use of my left arm. Yes.
And you were pronounced dead?
Literally, they were going to pronounce me dead before I came back during the code at 42 minutes. Because generally codes are run about 20-25 minutes. So since I was faculty over there in the past and I trained at Ohio State, they decided to carry it on a little longer.
And why did this happen? Was this because COVID was so new, or was it just, does this thing happen generally?
The perforation of the right ventricle, it is very rare during putting an ECMO. But the compartment syndrome, the negligence and the paralysis of my vocal cord, which happened thereafter, was because people were so afraid of COVID patients. People were afraid to come in. I had only 2 doctors who would come in and see me, and the rest of the people would just see me from across the wall, the glass wall, and write notes. No one came and examined patients. No one would come and do anything to patients. And Ohio was not even that overwhelmed in the hospitals like New York and California. In spite of that, the fear of COVID made the doctors not come and want to take care of their patients.
Yeah, one of those reasons. And also I can just think about the fact that no one was really allowed to talk about COVID as much as they should. So there was just this taboo around the illness. And as you mentioned, that might have created fear. So when we see COVID today, since we're talking about it, compared to COVID back then, do you think that the medical community has been better equipped for something like that?
I do believe we are much better off than we were in 2020 when it initially started, because we know a lot more. There's vaccinations, but there's still a lot of people who are stubborn and don't want to get taken care of right as soon as symptoms arise. So, looking at my state, I was one of those stubborn people too. But I would tell people, there's no harm in admitting you have something and get treated for it.
That's very interesting. And my final question is regarding your journey to becoming a doctor. First of all, we're very happy that you're well, safe.
Thank you.
You are going to become the president, and by the time this airs, you will be the president
Thank
of
you.
AAPI. Can you tell us about your journey of becoming a doctor? And we don't like to really talk about identity politics so much, but
Sure.
you are a woman,
Absolutely.
an immigrant here in the United
Right.
States, and you've excelled
Thank you.
to so many positions.
Yeah, I always wanted to be a physician in my family because my family is full of attorneys and judges and lawyers. So after getting into medical school at the age of 16, I came to this country at the age of 20 and went through my USMLEs, and then I went ahead and did started my residency at Hahnemann in Philadelphia, actually, and then did my fellowship in gastroenterology at Ohio State. So I always wanted to take care of others, less fortunate. For some reason, that has always driven me. And coming into AAPI has always, somewhere I found that women, I have this thing that even though we are treated, supposed to be equal, we are having women's forum, but somewhere we always have that barrier. And I really want people to know that we can do better than other people. Actually, we are great multitaskers because we take care of home and our work force. So I think women are the best people to take any leadership positions. Absolutely.
Well, thank you so much for
Thank
that.
you.
And,
I appreciate
we're
it.
talking to an
Thank you.
all-woman team here, so we agree
Absolutely.
with you.
Thank
so
you.
much.
Pleasure meeting you.